Good afternoon, everyone. Welcome to today's PHO Round. The presentation is on Peel Region's Heat Vulnerability Index. My name is Sue Keller-Ollerman. I'm a Manager of Evidence Synthesis in the Population Health Portfolio, and it's my pleasure to be moderating today's session. Typically, I would give a land acknowledgement right now, but this round is hosted by Public Health Ontario in Toronto. But the land acknowledgement today will be given by our Peel colleagues where the index work is based. And now I'm going to move on and welcome our awesome speakers. It's my pleasure to introduce Franca Ursitti, David Guillette, and Lydia Cheng. Franca is a Manager of Health Hazard Investigation and Vector-Borne Disease at Peel Public Health. Franca is a public health leader with over 20 years of experience. As manager in the Health Protection Division, Franca leads work in health hazard investigations and vector-borne disease, advancing evidence-informed strategies to protect community health. David is a data and GIS specialist at Peel Public Health. He has collaborated on GIS-driven public health initiatives that includes the Peel Health Data Zone Information Tool, the Healthy Development Monitoring Project, and the Peel Walkability Composite Index. These projects use spatial analysis and story maps to assess and communicate the built environment impacts on chronic disease and promote active transportation. Lydia is an epidemiologist with infection prevention and surveillance at Peel Public Health. Her work as a communicable disease epidemiologist supports collaborative, evidence-based decision-making to promote and protect the health of communities across Peel region. I will now pass the presentation over to Franca. Thank you very much.
Thank you. Thank you, Sue. It's a pleasure to be with you all today. As you heard, I'm Franca Ursitti. I'm a manager here in Peel Region, Peel Public Health, managing the health hazard investigations and vector-borne disease portfolio. And today we'll be presenting on the Peel Health Heat Vulnerability Index. Next slide, please. We do not have any conflicts of interest to declare. Next slide. Before we get started, we want to take the time to acknowledge the land on which we gather, which we recognize will be different for all of you depending on where you're tuning in from. For us, the region of Peel where we work is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land and continue to do so today. In particular, we acknowledge the territory of the Anishinaabeg, the Huron-Wendat, the Haudenosaunee, and the Ojibwa-Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. Before we dive into the details, let's start with what we hope you'll take away from today's session. First, we'll look at the three components of heat vulnerability and why they matter for understanding heat-related health risks. Next, we'll walk through how we built the Heat Vulnerability Index using Principal Component Analysis, or PCA for short, and the mapping techniques. Finally, we'll talk about how this index can be applied in real-world public health work, helping us target interventions and allocate resources more equitably. These objectives will guide our discussion and show why this work is important for climate and health planning. We'll begin with a brief overview of the context that led us to this work, along with what we've hoped to achieve. And we'll then discuss our methods, results, and the risk maps themselves, followed by how this work is being used and applied in Peel in a public health setting. Next slide. So just in terms of climate change and health vulnerability assessments, Peel was the first public health unit in Canada to complete one, a VA, as we'll refer to it from here on in. We did this in 2012 with the support from Health Canada. This vulnerability assessment was updated in 2023 Our community was growing and we had newly available data, more current data, and additional context to reflect in that report. And this VA provides a solid foundation to understand how climate change impacts public health at the local level. It serves as an opportunity to integrate the results and recommendations of the VA into an overall body of work being done at the region of Peel regarding climate change and health. And it assessed exposure, sensitivity, and adaptive capacity of various climate hazards to understand that overall vulnerability in Peel. 7 key recommendations stemmed from the vulnerability assessment. The work we will discuss today, the Principal Component Analysis and Spatial Mapping Project, advances 2 of those key recommendations. The first was to map vulnerable populations, neighborhoods in Peel, and the second is to begin a broader discussion around public health and vulnerability to climate change in Peel. Through the vulnerability assessment, heat was identified as one of the top 5 climate-related health hazards affecting Peel residents. And the PCA and spatial mapping of at-risk populations was completed on heat, and heat was identified as the climate hazard most experienced in Peel, the one that poses the greatest risk to the greatest number of people. This work aligned and aligns with our organization's strategic priorities, which identifies reducing health-related impacts of climate change as a key focus area for the time period of 2020 to 2029. We've been fortunate here in Peel that we have not yet had a heat event that has caused significant morbidity and mortality. However, nationally, those numbers are adding up. Prime example is, of course, the heat dome experienced in BC in 2021, where there were 615 excess deaths reported. Based on the projections, it's safe to say that it's not if Peel will experience a significant heat event, but when. Temperatures throughout our region have been slowly increasing from 8.9, from an annual mean of 8.1 degrees Celsius in 1938 to 9.3 in 2017. The most significant increases occurring in summer and winter. Just looking at this year alone, we had 24 days to date at 30 degrees Celsius or more, which when compared to the annual average in the last 10 years, the annual average was 21 and a half days. So even this year, we're seeing we saw an increased number of days over 30. The projection data for Peel into 2080s is showing shows an increasing trend in expected temperatures above 35. The manner in which heat impacts people is, of course, dependent on various factors. And a PHO study showed that for every 5 degrees Celsius increase in daily mean temperatures, there was a 2.5% increase in non-accidental deaths. These non-accidental deaths can be caused by exposure to heat, largely related to the length of heat exposure without reprieve, of course, leading to the inability to maintain those core temperatures. When this happens, heat-related illness such as heat stroke, heat exhaustion, fainting, and a number of other symptoms are possible, including death. There is a recognition that while heat has the potential to impact Peel residents, not everyone will be impacted equally. Next slide. So this project's specific objectives were threefold. Identify, assess, and map communities in Peel at risk of heat-related illness, begin discussions and strengthen understanding of how these communities are impacted by heat, and ensure effective and equitable programs and policies are explored to mitigate the risk. If we can identify neighborhoods in Peel that have greater vulnerability, such as less cooling or greater proportion of older people with chronic illness, we can identify priority areas for adaptation and mitigation efforts, such as increased tree canopy or implementing social connectedness programs, both indicators known to impact the risk of heat-related illness. Next, we'll provide an overview of the methodology used in this project, and I will hand it over to Lydia to discuss the principal component analysis methodology.
Thank you, Franca. So our methods were inspired by work by Vancouver Coastal Health Authority in 2020. First, we wanted to assess which of the factors identified by the vulnerability assessment were most important in Peel. To do this, we conducted a principal component analysis, or PCA, using area-level data at the census tract geography. PCA is a statistical data reduction method to make sense of complex relationships between related variables. We then computed a composite index called the Heat Vulnerability Index using data for the indicators selected through the PCA. I will describe this process in more detail shortly. The second part of the project was mapping the index across census tracts to identify which local areas had the most vulnerability to heat-related health impacts. We also conducted some statistics to assess spatial variation in vulnerability across census tracts. And lastly, we looked at how sociodemographic factors differed between areas of high and low vulnerability. Before I go over the PCA, I'd like to explain how we selected indicators to represent concepts identified from the VA. Examples of concepts included temperature for exposure, sensitivity concepts such as age, prevalence of chronic diseases, and adaptive capacity concepts including education, income, housing condition, impervious surfaces, air conditioning, and tree canopy coverage. In order for the indicators to be considered for the PCA, they needed to meet the following criteria. The data had to represent the concept accurately, the data had to be accessible and releasable, and the data had to be available and reliable at the census tract level of geography. A CT is a small, relatively stable geographic area with a population ranging between 2,500 and 8,000 people. In Peel, we have 282 CTs. Here are some examples of the indicators and data sources that we included and excluded based on these criteria. There were many census indicators that were available at the CT geography and described many socio-demographic concepts, especially related to adaptive capacity. Additionally, through our Associate Medical Officer of Health's university affiliation, we were able to access high-resolution land surface temperature from Canoe, which we summarized by census tract. ICES was also able to fulfill our data request for the prevalence of cancer, diabetes, respiratory diseases, and heart disease by census tract. On the other hand, while there were several self-reported health status measures available in the Canadian Community Health Survey, or CCHS, we had not completed an assessment of CCHS data at the CT level, so we excluded these indicators. We also looked at healthcare utilization data such as emergency department visits and hospitalizations. However, a high proportion of Peel CTs had very few events, even aggregated over a long time period, so this information was not releasable. Additionally, we wanted to measure the prevalence of air conditioning in homes and found a census variable describing the percent of dwellings built before 1960. However, we decided that this was not a good proxy for the presence of air conditioning. And lastly, availability of a municipal heat response plan was an indicator of adaptive capacity, but there was no variation across Peel for this indicator, so this was not useful. For the PCA, we began by identifying determinants related to vulnerability to heat from the vulnerability assessment. 22 variables were first included. These were then assessed against assumptions for suitability for PCA, including normally distribution data, linear relationships, factorability, and sampling adequacy, and sample size. Variables were also excluded if there was multicollinearity or if through the iterative process, it was determined that the variables didn't load on to any component. In the final iteration of the PCA, three components were retained, each containing three variables. These components were selected because they explained the most variance in the data. We renamed the first component as adaptive capacity, which comprised of measures for low income, living alone, and renters. The second component was named sensitivity and include measures for prevalence of cancer, respiratory diseases, and heart disease. Lastly, the third component was named exposure and included maximum temperature, tree canopy cover, and normalized difference vegetation index. Following the PCA, we computed composite scores for each census tract, including a score for each of the components and one score combining all three components, which we then called the heat vulnerability index. We calculated the scores by taking the equal weighted average of the normalized values for each variable that loaded onto each component. These scores range from 0 to 1. This table shows the three components and 9 specific indicators that loaded onto each component. As a reminder, each indicator summarizes area level and not individual level information. They are represented as a percentage of a census tract that has a certain characteristic. Data sources include the 2021 census, the Institute for Clinical and Evaluative Sciences data request, and the Canadian Urban Environmental Health Research Consortium, or CANU for short. The 9 final variables across the three components captured the most important patterns in the data. These variables collectively explained about 86% of the variance, meaning they retained 86% of the original data set's information. As you can see, some components explain more variance than others, meaning that they more accurately represent the variables they consist of. Sometimes when we see the percentages of these variances, we assume that these domains or categories are the most important in understanding the relationship between the exposure and the outcome, which is heat vulnerability. In this case, we are just being told which of our selected indicators explain the most variance. This method allows us to produce a more simplified index with fewer variables when capturing most of the uniqueness of the initial dataset. And now I will pass it over to David to discuss the spatial analysis and mapping.
Thanks, Lydia. You can move on to the next slide. Thank you. So before diving into an overview of the spatial analysis, maps, and web applications we developed to support the Heat Vulnerability Index, I wanted to briefly revisit the spatial objectives we aim to achieve with this project. Our primary goal was to create an index that measures differences in heat-related risk across Peel to help guide equitable program delivery and protect residents during heat events. Using principal component analysis and measures of spatial association, we were able to identify communities that may face elevated and disproportionate levels of risk during a heat event. Finally, we conducted an exploratory ecological analysis to examine socioeconomic, health, and built environment factors that influence these areas. This analysis provided insights into the specific challenges vulnerable neighborhoods may encounter in the future. Next slide, please. Thank you. After validating the results from our PCA, we mapped the Heat Vulnerability Index in its three components, adaptive capacity, sensitivity, and exposure, to examine spatial variation across Peel and begin identifying these vulnerable areas. The HVI is a normalized index that includes each of the component scores. Normalization ensured all values shared a common scale for consistency and easier interpretation. Specifically, the HVI is calculated as the normalized cross product of the component scores, and the component scores are the equally weighted average of the normalized factor scores assigned to our variables during the PCA, as Lydia just discussed. We first visualized the results and assessed large-scale variation using choropleth maps with quintile classification, meaning all 282 of Peel's census tracts were equally grouped into 5 buckets comprising 56 or 57 census tracts. A choropleth map uses different colors or shading to show how a value changes across a geographic area. These maps are often used to reveal broad patterns of areas of greater vulnerability. However, maps alone are subject to bias and lack statistical significance, meaning they are unsuitable as the sole basis for justifying targeted program planning. To address this limitation, we applied spatial autocorrelation statistics to confirm whether the observed pattern or clusters were statistically meaningful and therefore appropriate to support health protection initiatives. Global Rand's I measure particularly, which measures whether similar values are grouped together geographically more than we'd expect by chance, or in other words, it checks if there's a real pattern in our data, or if the data are actually randomly dispersed across the study area. For our analysis, both the HVI and its components demonstrated significant clustering, meaning the patterns we see on the maps are real, and this allows us to drill down to neighborhood level variation and identify areas in Peel that may require extra attention during heat events. The maps presented on the next four slides include the results of our large-scale and local-scale analysis. The map on the left reflects the adaptive capacity values for census tracts in Peel and reflects our initial assessment of large-scale variation. The values have been classified using quintiles and displayed using a dark orange to dark purple color ramp. Orange colors are associated with quintiles 1 and 2 and highlight areas with lower vulnerability. Purple colors are associated with quintiles 4 and 5 and highlight areas with greater vulnerability for risks associated with adaptive capacity. Examining the map, you will notice trends within Peel. For example, central Mississauga exclusively contains values within the 3rd to 5th quintiles, suggesting this area likely includes a disproportionate number of low-income renters who live alone and who could be more susceptible during a heat event. The map on the right is a cluster map. It shows the result of small-scale analysis and highlights patterns in the data that our eyes might suspect but were unable to quantify. These patterns helped us visualize where vulnerable populations are concentrated and where extra support may be required during our next heat wave. The map on the left for sensitivity reflects the variation in the presence of existing conditions that could become exacerbated during a heat event. These conditions include cancer, heart disease, and respiratory disease. Again, the values have been divided into quintiles and displayed using a dark green to dark purple color ramp, with green colors being associated with quintiles 1 and 2, highlighting areas with lower sensitivity, and purple colors associated with quintiles 4 and 5 and highlighting areas with greater sensitivity. Examining the image, you may notice the upper and lower portions of the map have a disproportionate number of census tracts within the 4th and 5th quintiles. And at first glance, these areas may appear to have generally less healthy populations. However, it's important to note the analysis based on the crude or unadjusted prevalence rates. Because chronic diseases are more common among older adults and these areas have relatively older population, the observed pattern primarily reflects age composition rather than poor health status. Crude rates were prioritized because they represent the actual burden of disease within the population and are better suited for identifying where the greatest number of individuals with sensitive conditions reside. The local area analysis map on the right identifies clusters in Bolton, a town in southeastern Caledon, and across Mississauga, confirming our observations. These findings can help prioritize wellness checks and targeted interventions for vulnerable populations. The exposure dimension is unique as it highlights differences in the natural environment, such as tree canopy cover, the normalized difference vegetation index, and temperature, rather than population characteristics. The map on the right shows a concentration of high exposure value along Peel's eastern border with Toronto, an area dominated by major transit corridors, airport infrastructure, and industrial developments, with very minimal tree cover. In contrast, neighborhoods in southern Mississauga, along the Credit River, and the extensive greenbelt areas in Caledon exhibit greater vegetation and canopy cover. The cluster map confirms patterns consistent with on-the-ground observations. When analyzed alongside the other dimensions, this data can help us prioritize neighborhoods with lower adaptive capacity, sensitive populations, and increased exposure risk during heat events. Once combined, the three components from the PCA resulted in the Heat Vulnerability Index. The map on the left displays HVI values for each census tract in Peel, classified into quintiles and shown using a dark green to deep brown color ramp. Green shades represent quintiles 1 and 2, indicating the least vulnerable areas, while brown shades correspond with quintiles 4 and 5, highlighting areas with the greatest vulnerability. Higher vulnerability values are concentrated in central Mississauga, Brampton, and in areas near the airport. These insights can assist public health practitioners in advocating for and designing targeted interventions, including preparedness plans to allocate resources to these communities during a heat event. This slide features a screenshot of our Heat Vulnerability Index dashboard, a public-facing mapping application created with ArcGIS Online. The application can be accessed via the link or QR code included in case you want to explore the index on your own. After completing the Heat Vulnerability Index, we conducted a brief exploratory analysis to better understand the neighborhoods and populations in Peel that may be more vulnerable to heat events. Although our findings were not adjusted for known associations with the variables included in the index, it did provide additional insights that we hope to explore further to better understand the challenges faced by heat vulnerable communities. Select findings included recent immigrants are 19% more likely and refugees 27% more likely to live in the most vulnerable census tracts compared to elsewhere in Peel. And active commuters, or those who reported using public transit or walking to work, were 44 and 70% more likely to live in the most vulnerable census tracts. And before passing the presentation back to Franca to discuss the public health applicability of this work, I wanted to highlight a few common limitations of area-based indices and reflect on the intended use of this analysis. Area-based indices capture typical characteristics of the communities they represent. And while these indices can serve as a proxy for individual level data when such data are unavailable or difficult to obtain, the results cannot be used to characterize individual residents. And with most area-based or ecological studies, we must consider the impact of the modifiable area unit problem. This issue arises when aggregated exposure outcome statistics vary depending on the geographic boundaries used for aggregation. As we move from smaller to larger geographic units, the association between exposure and outcome may weaken, shifting from statistical significance to insignificance. Confirming the direction and strength of associations across multiple geographic scales can help validate the results and mitigate this concern. Our intention with this work is to demonstrate that climate hazards do not affect all people equally and that efforts to protect health outcomes must account for the social determinants of health. We hope this analysis advances our collective understanding of climate change impacts on communities and contributes to conversations aimed at reducing health inequalities. Thank you for your time, and now back to you, Franca.
Thanks, David. Moving on to how this analysis will help reduce the risk of heat-related illness in Peel. It's the so what now, and how are we going to use this? At a very high level, and to recap, you just heard that some modifiable factors or some components, like adaptive capacity, explain more variance than other factors. And this simply means that they more accurately represent the variables they consist of, noting the greatest proportion, 45.9%, are from social economic determinants. Identifying the factors with the greatest potential of reducing the risk of heat-related impacts helps us focus our intervention planning for both upstream mitigation measures and downstream adaptation measures for when addressing heat events. You were also shown that these factors or components, the C in the principal component analysis, can be examined by place. We can see which areas and communities at the census tract level have the greatest vulnerability. Of course, we can do this at a combined or an aggregate level with all of the components, or consider at each individual component level. Knowing where and which communities to prioritize for specific interventions in any of the component areas helps us be more intentional and focused. And it's a starting point where we can then add consideration for factors that may have an impact but was not included in the PCA when working with specific communities on specific projects. We'll dive deeper a little bit into how this project has and is supporting our work here in Peel. At the local level, the outcome of this work can be used to support planning and policy development, which we saw a bit of that come up in the word cloud exercise. We can do this by gaining, and it'll help us gain an understanding of which areas are at greater risk to the health impacts. While this work does shed light on important pieces of information, it is important to note that we do consider it a starting point when working with communities. As mentioned before, there are likely additional factors not currently that we couldn't include in the index for various reasons that may be applicable and important when working with specific communities. And of course, as they become available, if additional data becomes available, we'll update the index. And it may in fact change the profiles and the overall maps depending on the data. For example, if we gain access to robust data on air conditioning and cooling at the census tract level, we'll certainly try to integrate that into the adaptive capacity component. And it tells a different picture, of course, on overall vulnerability. Next slide, or yeah, click, thank you. The analysis can also provide opportunities to lead and support upstream, as mentioned, upstream mitigation and downstream adaptation measures to address the impacts. We are using these analyses to prioritize neighborhoods for interventions by identifying the greatest vulnerability and assess. We're also, it helps us assess the risk levels across Peel to support that tailored community-specific planning. I'll also mention here that in Peel, we're currently in the midst of a theories of change outcome-based planning process, which this also will help build out this work, and this tool will help us build out that whole plan. Next. The Heat Vulnerability Index can also support the development of environmental and climate change urgent response plans and guide responses to heat events and heat emergencies. We saw that also come up in the word cloud. The index is a useful tool for emergency management and will allow us to work with our partners in our corporate emergency management and of course, our local municipalities and help us program to help us support areas of higher risk of heat-related illness during those emergencies. Next. And this has also been helpful to bolster our continued collaboration with various partners. We've engaged partners, including staff from the cities of Mississauga, the town of Caledon, the Toronto and Region Conservation Authority, and the Credit Valley Conservation Authority. We've shared this work with them through various knowledge translation activities and discussions, and it helps us better understand how this work can support their local planning initiatives. We've shared our methods, our data to help them, to enable them to use this tool in planning equitable heat health programs and policies. And as an example, the TRCA has used these maps to identify priority areas for tree planting in the Humber River Watershed Plan, and has also included this index in their Standards Council of Canada and Health Canada Heat Health Vulnerability Mapping Review. Internally or within Peel, we've also shared this tool with our own Peel Urban Forest Working Group as they continue with their work plan. To further support knowledge translation and access by local partners, the map displaying the geographic variation in the HVI across Peel has been shared on the Data Zones website, the link which is on the screen. You'll find the HVI maps under the Climate tab. And within our own organizations, we've been able to leverage this work to support ongoing initiatives related to both Peel public health programs, such as the built environment work that David also mentioned, as well as other regional priorities. And some of that work is work that we've engaged in with our housing services group. In Peel, we have an Office of Climate Change and a corporate Office of Climate Change and Energy Management, which is a key partner with us, and we work very collaboratively with them to, in this context, to protect and expand green infrastructure in Peel using the best available science and incorporating equity in the planning. And this index mapping tool can help support infrastructure resilience planning and the prioritization of capital investments. So by overlaying this index and asset information, location information, the region can identify and prioritize some projects that adapt those assets in areas of greatest exposure to heat. It helps ensure that capital budgets are allocated effectively and that adaptation measures are targeted where they are needed most. And lastly, we have used this work to leverage and strengthen proposal applications related to heat health work, including some funding and grant opportunities through the Heat Adapt program and the Green Municipal Fund. For example, the data used to support a grant application for tree planting within our Peel Housing Corporation properties to ensure greater access to shade among tenants. And the next slide, it shows a map that speaks to that example. It demonstrates how data can guide and help guide climate resilience planning. This collaboration was between our Office of Climate Change and Energy Management, Housing Services, and the Toronto Region Conservation Authority, where it integrated climate vulnerability data with housing infrastructure planning data. And this map, the heat vulnerability map on the left, has been overlaid with the yellow dots. That may be a little difficult to see, but the yellow dots, they represent our Peel-owned and operated subsidized housing buildings. And this identifies which housing building may need prioritization for climate resilient retrofits, such as shade interventions. And what you can see from the chart on the right is that 56 of the 99 housing buildings are in the highest heat risk quintile, indicating a greater prioritization needed for retrofits in those buildings. It's the kind of information that is really helpful when advocating for funding or grant opportunities, and it shows where those needs are concentrated and how investments can be targeted. It is important to know that in this particular example, that the variables used in the heat vulnerability index, such as renter status and low income, tend to select for Peel living buildings, and it reinforces the relevance of these buildings in climate adaptation planning. Okay. In these cases, although the index score is high for an area, the degree of exposure can be low depending on the individual building, and once it needs, that specific kind of working with specific buildings, we then understand the risk. The heat index can contribute to prioritizing, in this example, to prioritizing Peel Housing Corporation buildings for future heat adaptation measures and infrastructure support. Next slide. So this work, to wrap up, went beyond the previously done maps that looked at areas that were the hottest in Peel. We took the next step to integrate those health status and social determinant indicators that show us where we need to focus our attention further, particularly for those that have a greater risk of experiencing heat-related illness. I did want to take a moment to acknowledge the team here listed on this particular slide. It's a perfect, this project was a perfect example of cross-divisional and cross-discipline collaboration with just an absolutely amazing group of professionals. It was an absolute pleasure to work with them. Next slide are a list of the references for this work, followed by the slide of our data sources that, of course, you will have access to this slide deck once it gets posted to the website. And we thank you for your attention. We will open it up to questions, but I will note here on the last slide that our email addresses are noted here, so do feel free to reach out if you have any additional questions or want to discuss this further. Thank you all. And I'll pass it over to Sue to take us through the Q&A.
Thank you very much, Franca, Lydia, and David. That's a great, insightful presentation on the heat index. We're now going to move to the Q&A section, and I will try and keep up. I'll be looking at the questions we have in the Q&A chat. And as a quick reminder, if you haven't put a question in there and you have one, you can just pop it in the Q&A pod. There's a couple of questions in there already, and I think you might have alluded to the first one, Franca, already, and it's around: is using low income and renters as variables for adaptive capacity not measuring very similar social factors?
I can take that one. Yeah, I think if you look at the literature, those are two indicators that would definitely be associated. I think this is why it's particularly important that if you were conducting similar work, to make sure you were adjusting your data to the local context. So specifically, the reason both would be included is that during the PCA, the multicollinearity factor wouldn't have been greater than zero point 0.8, which would have been our cut hold to say like these factors are in fact too similar. We need to keep one and drop the other. And then I think just providing a quick commentary on in Peel is that the very nature of housing unaffordability in Peel results in a lot of individuals who are higher income earners to rent, specifically in early parts of their careers, before they've maybe developed enough money or have family who can help support them in purchasing a home. So that is probably another reason why that specific indicator in the Peel context was included as not being significantly similar to only include one.
Great, thank you for that. Another question is, again, it's related to a social factor, and it asks, has there been consideration given to including data regarding populations experiencing homelessness?
I'll start the response to this, and maybe I'll ask Lydia and or David to respond. But when I think back when we were looking at this, starting this project, certainly we identified it as an at-risk population for the adverse health outcomes, but I don't believe I think there was a data limitation here in terms of available data at the census tract level. Maybe Lydia, could I ask you to confirm that?
Yes, on one of our slides, we showed the criteria for selection of indicators in the index for consideration. And unfortunately, we don't have area level data or even at the Peel level data that I'm aware of that will capture the prevalence of homeless populations in Peel and their characteristics. So definitely something that's missing from this index.
Yeah, I'll just quickly provide like an update on some data collection that's happening in Peel. And this might be an analysis that we do something more similar to with the Peel Living Buildings, is that I think Peel, along with the municipalities of Brampton and Sutter, are starting to collect data on homeless encampments. So we may be able to look at where those are located and provide the intersectionality between that and the heat vulnerability index to see if these areas are disproportionately going to be impacted during heat events and like what kind of outreach can happen during that time.
Right. I have another question, and it's really around, it's sort of a general question, so I'm not sure who it could be angled towards, but in this area of, era of misinformation, disinformation, and especially with respect to the risks of heat on health, you've talked about the practical application, for example, for Peel Region and organisations. Do you have any thoughts around communicating this type of science to just the general population and what kind of information or anything different that might be needed to help share this sort of so it's more widely known in the general population?
Maybe I'll start us off here. So the kind of the knowledge translation and awareness building in the general population. I think we certainly think a lot about that, and we try to take and leverage all the opportunities to do that, whether it's through our collaborative programs within public health. I think of the work we do with our schools and our childcare centers, and we have various partners and collaborators to make sure we share that information. And we do that through various tactics, depending on what's relevant for the partner and the communities we're working with. With heat in particular, the heat and kind of the impacts that excess heat, extreme heat can have on people. We're not, at least locally, I'm not hearing uh, a lot about, kind of disinformation around. It's not, it is accepted. People generally understand those risks that link to climate change. I think people do appreciate that, it is hotter at times, that we might be seeing more events or times, episodes where we're asking for greater attention and caution because of that. Writ large around climate change as a broad issue, certainly that is the disinformation issue is still present, and as we all do, kind of we use the data and the evidence, data driven and evidence informed to really just to illustrate, to inform our and be the basis for that awareness and that education and sharing that to very broadly, and then specifically to the individual communities that we work with and our partners. And we also do quite a bit of work supporting our partners to then amplify this and build this awareness as well. I mentioned a few schools and childcare, but it extends to our big partners, our local municipalities as well, and supporting them with the programs that they deliver. So certainly we're aware of it, and we kind of use the data and this information to kind of to be that underpinning and that support.
Great, thank you. Then we have another question, and it's specific to air conditioning and asking, have you explored other data sources for availability of air conditioning?
Maybe Lydia, I'll ask you to address that.
Sure, yes. I just recently became aware of a Statistics Canada survey called the Households and the Environment Survey, or HES, and there is a specific question about the presence of air conditioning, just yes or no. So we'd like to explore that further with Statistics Canada to see whether that's available, firstly at the peel level, and if we can drill down at a smaller area geography.
Great, thank you. Okay. I'm not seeing any other questions coming into the pod, so I think if it's okay with everyone, we can actually give back some time today and close off a little bit early. I think as we're wrapping up here, I'd really like to thank Franca, Lydia, and David for presenting this interesting topic and this great session on the index. And I'd like to thank everyone who's joined here today to listen in on this event. For those that are listening, you can expect to receive a brief and anonymous survey about today's session. And if you can please try and complete that, then it'll help with our own programming and making everything better and better. So if there's no further questions, I'd like to thank you all once again, and I hope you all have a fantastic day.